Hello, good day. So today I am going to demonstrate to you how to do the CPR and rescue breathing for infant, children, and also to adult. But before that, I am going to explain to you what is the difference between the basic life support and also the first aid. Because I am always confused about are they related or not? So, first, what is basic life support? So, this is the type of care where the rescuer or the responder should know about how to care a client who suffer from cardiac arrest, heat stroke or stroke, heart attack, and obstruction of airways. And then, in basic life support, it is vital that you need to know how to do the CPR and also how to use the automated or automatic external defibrillator or the AED. The second one is the first aid. What is first aid? Actually, first aid is the one you're going to apply if there are some cuts, incisions, lacerations, avulsion, or you want to apply treatment to a first, second, third degree burns, or if you will need to have stitches to a serious injury of your patient. So that is the main difference. So again, basic life support is more on heart attack, stroke, cardiac arrest, and obstruction of airway, while first aid is more on the cuts. You're gonna apply dressing, bandage, treat burns, or first do application of topical cream for burns, and even stitches. So, we are now ready to perform, or I am now ready to discuss to you the proper position and how to do the infant CPR and also the rescue breathing. So the primary rule in doing the CPR is first, you need to make sure that your surroundings is safe. When we say safe, there is no blockage. If we know that some Filipinos are marites, you may actually tell those individuals to stay away from the scene so that the victim can actually breathe well if the victim can regain his or her conscious. So first, since I've already discussed to you, ang CPR, and the CPR is for cardiac arrest. Again, for cardiac arrest, obstruction of airway, and also stroke. Not just that, is also for heart attack. So, why is that infant have to be CPR? Because emergency and heart attack it always happen in all through ages. Even you're infant, even if you're adult, child, it happen in any ages. So, first is after getting the infant into a safe position, we're not allowed to do that to transfer the child. But there is the rescuers. We're just the responders. Okay? We're not allowed, for example, the infant is in the burning house. We're not allowed. We're not the right individual to transfer the child into the safe position. These are the rescuers, such as the fire brigade or the policeman. So, first is, you need to make sure that the place or the scene is safe. Tap the child's foot. Hey, baby, are you okay? Baby, are you okay? And then, this is the time where, for example, you have a lot of people is just on the scenes, then you can just say, hey, call 911 and ask for help and ask for an AED. So, after that, you have called somebody's attention to call for emergency. You can now check the breathing, not just the breathing, but also the pulse rate of the individual. So the best way to checking the pulse rate of the individual is by his radial pulse or by the carotid artery. So for example, where is your dominant hand? My dominant hand is my right, but you will be going to use your non-dominant hand in checking the baby's pulse. Why? Because they said that you are more sensitive on your non-dominant hand. So, and also, by checking the pulse rate of the baby using his or her carotid artery, you need to make sure that it is on his or her right side, his or her left side, I mean. So this is my non-dominant hand, and I am going to check his or her pulse in his or her right side. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1008, 9, 1010. You can also use his brachial, and along as you can also hear the breathing of the baby. Make sure to scan the breathing and movement of the baby from his or her breast to the tummy or the chest, from his or her chest to the tummy. So another thing is in 2020, American Heart Association, because there is this update guidance on how to CPR a baby. Actually, in 2020, there is this what we call revision. Since before 2015 revision, there is no pandemic yet. There is no PPE being used in doing CPR to a victim. But now they said that if ever you need to the new guidelines or CDC guideline is you need to apply face mask onto his or her mouth, not to your mouth, because you as the first aider already know that you are already vaccinated. You know that you are safe. You cannot transmit any disease to the victim. But the thing is, you don't know if the victim had already taken his vaccine. So, to make sure your safety as a responder or as a first aider, you need to apply face mask onto the victim's mouth and nose. That is the new revision of 2020 AHA in doing CPR. So, but I am going to demonstrate the 2015. But I'm just trying to explain to you what is the 2020 new revision. Okay. And not just that, in 2020 revision, there is no rescue breathing anymore. What you just need to do is do the compression up to 100 to 120 compression or per minute. But I am going to apply the 2015, but I just want you to let you know that there is some revisions before this year, or such as in April 9, 2020. You can just look at that on the internet. So again, after checking the baby's breath and after answering, is the baby moving? Is the baby breathing? Is the baby gasping? If you know that those analyses that the baby don't have any movements, then that is the time we're going to apply the CPR. So again, locate your dominant hand. This is my right hand, is my dominant hand. You need to use this and put it on the sternum, in the chest, center of the chest, under the breast of the baby. And then use your non-dominant hand in holding the baby's forehead. And then beat it or compress at least 30 seconds. 30 compression I mean. So, you need to perform 30 compression and 2 breath per cycle. So, you need to do this 1 minute. So, 1 minute should have 5 cycles. So, you are expected to perform in 1 second 2 compression, and within 1 second is 1 breathing. So, for example, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then, you need to make sure that the baby's chest will actually go up as your finger goes up also. Not just that, you need to make sure that you're holding the baby, your finger should be on top of the baby's chest. Do not take it away. And then, after that, you need to perform the rescue breathing. So you need to do at least 100 to 120 compression and then 10 rescue breathing. So, you need to hold the baby's forehead and use your fingers in lifting the baby's chin upward to the ceiling. And then, do the breathing. You need to make sure while blowing, the baby's chest is also moving upward. And also make sure that the baby's chest is also moving downward. So, you need to check the baby's vitals such as the pulse and also the breathing every after 1 minute. So, guys, I will demonstrate now how to CPR and do the rescue breathing without any interruption. Make sure that the scene is safe. Tap the baby's feet. Baby, what happened? Hey you, the one with color blue t-shirt, call 911 and please let them have the AED. Check the baby's pulse using the radial artery and also the carotid artery. 1, 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. So, there is no response yet. So, we need to make sure that we will apply the CPR and also the rescue breathing. So, cut the baby's shirt using a scissor from upward to downward. Use your forehead, use your hand in holding the forehead of the baby, and then use your dominant finger in your right hand in doing the 30 compression and 2 breathing per cycle. So within 1 minute, you need to do 5 cycles. So 1, 2, 3, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. And then use your finger. 2 fingers in lifting the baby's chin upward, facing the ceiling. And do the rescue breathing. And then, do the compression again for 30 beats, and make sure that your finger is at least 1.5 inches deep in his or her chest. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. Third cycle. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 1, 2. Fifth cycle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 22, 23, 24, 25, 26, 27, 28, 29. Check the radial pulse of the baby. Pulse is now visible. I can feel it. And also breathing is now visible. Put the baby in the recovery position. For CPR and rescue breathing of a child, let's say this is a child. So this is just the same with the infant where you need to have or at least perform 30 compression and 2 rescue breathing in 1 cycle, or 5 within 1 minute you need to perform 5 cycle of compression and also rescue breathing. So the main difference is that you will need to use your whole hand on your dominant side and then put it onto the sternum of the individual. You make sure not to flatten the position, but you need to, it is somewhat sideward. Not flat, but sideward. And you make sure place it onto the chest of the individual. Make sure that the heel of your hand should be placed on top of the chest. So, and of course, in the rescue breathing, you need to pinch the nose of the individual and then use your 2 fingers in elevating the chin of the individual onto the ceiling and then do the breathing. So that is just the main difference between the two. I will now perform it. So you need to make sure that your 2 knees is on the, one knee should be level on the breast of the individual and the other is on the tummy so that it's easier for you to move. And then make sure that the scene is safe, and then if there's someone there, hey, please call 911 and please let them breathe the AED. And then you need to tap the individual, hey, are you okay? What happened? Then you need to make sure that you are going to check from chest to the tummy if there is a response or movement. If the individual is gasping, you need to make sure that you check the pulse if there is pulse using the radial artery or the neck artery. So 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. There is no response, then you need to do the CPR. So put your one hand or non-dominant hand on the forehead of the individual to hold it, and then use your other dominant hand and place it on the sternum under the breast of the individual in the center, and then do the 30 compression at least 1.5 dips onto the chest of the individual. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9. And then pinch the nose of the individual and use your 2 fingers and lifting it onto the ceiling and do the rescue breathing. And then again do the 30 compression. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 22, 23, 24, 25, 26, 27, 28, 29. Third cycle. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. Fourth cycle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Fifth cycle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. Check the individual's pulse using the radial artery or the carotid artery and listen to the breathing. The individual gains conscious. So position the individual in a recovery position. So for an adult, compression and all CPR and also rescue breathing, the difference is that you need to use your hands, your dominant hand onto the chest of the individual and use your non-dominant hand on top of it and interlock it. And then place it into the chest of the individual until its sternum in the center under the breast, and then place first the heel of the dominant hand. Do not actually flat it, but slightly diagonal, or place it diagonally or slightly sideward. Okay? So let's do it. Make sure that the scene is safe. And then, talk the individual. Sir, what happened? Hey, you, the one wearing yellow t-shirt, please call 911 and please let them bring an AED. Then check the pulse using the radial artery or the carotid artery. And also check for breathing from chest to the belly. Check first the pulse. 1001, 1002, 1003, 1004, 1005, 1006, 1007, 1008, 1009, 1010. There is no movement. And also, there is no breathing. So, you need to perform the compression. 30 compression for one cycle and also do 2 breathing or rescue breathing for one cycle. So, for 1 minute, you need to at least perform 100 to 120 compression and 10 rescue breathing. So, for compression, you need to use your dominant hand and interlock it with your non-dominant hand and put it into the sternum, into the center of the brace of the individual. And then count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 21, 22, 23, 24, 25, 26, 27, 28, 29. Pinch the individual's nose and then use your 2 fingers in lifting the individual's chin onto the ceiling. Do the breathing. Second cycle, you need to make sure that your hand should be dipped up to 5 to 6 centimeters onto the chest of the individual. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. Third cycle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 15, 16, 17, 18, 19, 20, 1, 22, 23, 24, 25, 26, 27, 28, 29. 1, 2. Fourth cycle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 1, 2. Fifth cycle. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 22, 23, 24, 25, 26, 27, 28, 29, 1, 2. Check for breathing and also the pulse rate. He's now gaining conscious. So, put the individual into the recovery position sideward.